component from you guys, our members here. We have an expert panel here and we'll be introducing them later on. They have some incredible bios and have a call to action on maternal mortality, our theme for today, and a closing. Next slide, please. Great. So we now have this component of the meeting today, and it's basically an open discussion where our members, you guys and us, could share stories and personal experiences, like welcoming a newborn into the family, how a woman plays a role in your life, and how that adds to the bigger picture of having a family, as Marquise mentioned. So that's why, like, in the invitation that we probably sent out in newsletters, we actually asked people to have to submit a story. So if anyone would like to participate in talking about maybe the significance of women in the roles that women play in their lives and how that adds to the bigger picture of family. I don't know, Marquise, if we had someone that volunteered previously.
In the
Or
meeting,
Gwen.
yes, Emily. I'll just briefly share the story of my sister, who actually went 9 months, almost full term, and then it was discovered that the baby she was carrying was suffocated by the umbilical cord. So it's devastating when you're anticipating the arrival of a new baby and then you have to prepare for a funeral. This is something that's happening a lot in our communities and need more awareness. I personally had toxemia, which is also another name, and many women, particularly women of color, are suffering from toxemia, which is uh, it develops during your pregnancy, and you try to your body actually reacts to the pregnancy, and it causes high blood pressure and a lot of other ailments. And some women have lost their babies 2 months, 3 months, 4 months, 5 months. But I believe in holistic healing, and I was fortunate that I went to a pharmacy who gave me some herbs. So I ended up having my son in the 7th month, and he was 3 pounds, and spent 1 month in NICU. And recently, a 23-year-old young lady died in childbirth. So there's a lot of disparities in healthcare. I paid back then when I had my son. I paid so much money for my healthcare. I was thinking almost $400 a month for healthcare, and come to find out, it didn't even cover my entire hospital stay. So there is a big disparity. It's heartbreaking to lose a baby, whether during childbirth or the baby is born stillborn, and it's something that we really have to start working on to make sure that women, and particularly young women who are just having their first baby, like this 23-year-old who was heard about her story. And so we need more access to healthcare and coaching, more coaching. And I'm glad that we have a little better healthcare than 23 years ago when I was having my son. So it's very important that we're talking about infant mortality. We're talking about the subject matter.
Great. Thank you so much, Gwen, for sharing. Is there anyone else who would like to share? Um, I mean, particularly, it doesn't have to be about, loss at all costs. The role that women play, especially in my family, let's say, I just know that it's basically like a connecting role. Like my mother, she's always trying to make events to feed people. And everyone always wants to eat. So she'll just be like, hey, I'm having a dinner this weekend. And then everyone just pulls up. So I feel like that component of togetherness in the family is something really important that like women in my family, that role that they play where they get everyone together. And it's really important. And it doesn't even have to be for family, like neighbors come visit, you know, even if there is like bad things going on in the family or people are like there's friction, they still always come together because of these events, and it's mostly the women in my family that get together and do that. So I'm just really grateful to the women in my life, at least, or and it doesn't even have to be family, just in general, mentors and every kind of woman. Let's see, I can't really see if anyone's raising their hand or if they just kept their hand raised. Here I see David Vassar. Can't really unmute anyone.
Yeah, I think David's hand, I'm going to lower his
Kept it
hand.
up. Okay.
David, did you want to share the last moment?
No, actually not yet, but thanks. Yeah.
But allow me to put you on the spot, though. May I put you on the spot?
Sure.
I do want to just kind of push you to maybe share with us a little bit about the last time you remember welcoming a newborn into the family and what it was like for you.
Welcoming a newborn. Wow. Yeah, this would be, oh boy, this too is really rough. All right, this was my nephew, John, and my sister and brother-in-law, Susan Tom, had John, their third child. And John was kind of unexpected. He was kind of like a gift. They already had two kids, both of whom, were great, Robert and Diane, just great children. John kind of early on was having issues just adjusting. And I really related to the kinds of problems he was having, finding his way in this really strange world. And he was always kind of a favorite of the three of mine. And yeah.
Thank you.
John, he took his, I just have to say, he took his life 10 years ago.
I'm sorry.
And it's really okay. But always be fond of John. And it actually brought me closer to his parents. It really has. Because we think differently politically, religiously, and in so many respects, but all these dividing lines kind of just melted, at this event, at this loss. So,
David,
that's it. Thank you.
I can't thank you enough for being in that vulnerable space for us. It's never easy. But the moral I found in your story was that, when that new child comes in, all our differences go out the window. We all come together.
Yeah.
Thank you. Emily? You're on mute.
Sorry, I was muted. Yeah, thank you so much for sharing, David. So yeah, we do have losses, we have gains in any kind of family atmosphere. Sorry, I was just looking at the time. I'm not sure if I'm over. Marquise.
Yeah, maybe one more. We have time for maybe one more.
Okay, one more story. Is anyone willing to share? So I don't know if I could trust the hand raised.
Louis Kleiman. Louis, is your hand still raised?
Yeah, why not? And I'm so old that my kids are ready to have kids, and who can remember what happened when they were born. But I just wanted to put the shout out that we should all get behind push to expand the Medicare for everyone.
There you go.
Thank you. Well, thank you, Louis. All right. So I'm not sure, do you want me to move along, Marquise? If so, I could go on to the panel. So I want to introduce our other planning committee member, Whitney Goodwin. She will be introducing our amazing panel today that will be talking about maternal mortality. Brittany, not sure if people have to unmute her or she could unmute. There you go. Okay.
I think I'm unmuted. Can you hear
Okay,
me?
yes, yes, I can hear you now. Great. Mhm.
Hi, everyone. My name is Whitney Goodwin, and I'm going to be leading our panel discussion today with Dr. Rupa Basu, who is the Chief of Air and Climate Epidemiology section at the Office of Environmental Hazard Health Assessment of California's Environmental Protection Agency. She will be joined by Chanel Portia Albert, who is the founder and executive director of Ancient Song Doula Services, and on New York City Mayor's Commission on Gender Equity. So if you will bear with me, I'm going to briefly read their bios so that we can prepare ourselves to welcome them. Dr. Rupa Basu is currently the chief of the Air and Climate Epidemiology section at the Office of Environmental Health Hazard Assessment of California's Environmental Protection Agency. She has published extensively on research focusing on examining temperature and air pollution on health outcomes, including mortality, morbidity, and adverse birth outcomes, while identifying vulnerable subgroups. Prior to joining OEHHA, she worked on the U.S. Environmental Protection Agency after obtaining her PhD degree in epidemiology from the Johns Hopkins University Bloomberg School of Public Health and her MPH degree from the UCLA School of Public Health. She collaborates with external agencies such as the Scripps Institute of Oceanography and Kaiser Division of Research and Research Studies that have been federally funded. She serves on several statewide and national climate change committees and has been an invited guest speaker on many occasions from academic settings, including teaching a course on climate change and public health at UC Berkeley, to governmental leaders such as former Governor Schwarzenegger. She was featured in the Emmy Award-winning climate change documentary, Years of Living Dangerously, Mercury Rising episode with Matt Damon. Dr. Basu's work is widely cited, and she has served as a referee for many health journals and has reviewed several grant proposals and reports for federal and state governmental agencies. Commissioner Chanel L. Portia Albert is the founder and chief operating officer of Ancient Song Doula Services, a reproductive health organization of over 150 full-spectrum community-based doulas focused on providing resources and full-spectrum doula services to women of color and marginalized communities throughout the New York City and northern New Jersey. She is a certified lactation counselor, midwifery assistant, and vegan chef who has served on various advisory boards throughout the country, when she is not working on legislative policy or facilitating workshops. You can find her spending time with her 6 children. So please, everyone, do welcome our guests, Dr. Rupa Basu and Commissioner Chanel Portia Albert.
We're all silently applauding.
Great. So, Dr. Basu and Ms. Albert, I wanted to start with a question for both of you. Please feel free, whichever one of you wants to begin. But my question would be, based on your experiences and research, what are some of the causes of racial disparities in maternal health care?
Brittany, I actually have a few slides, and in one of those slides, at least, I talk about that a little. Should I give my presentation first? This is
Yes,
Rupa.
please. Go
Okay.
ahead. Yes, let's. You can definitely go ahead and do that.
Yeah, hopefully it will answer some of your question, and then we can discuss some more. Let me bring up my screen here. Okay. And let's see. Okay, well, thank you so much for that really nice introduction. It's my pleasure to be here. And let me see if I can change this view so I can show my presenter view. There we go. Okay. So my presentation will be on environmental justice issues related to ambient heat exposure and adverse birth outcomes. And I really enjoyed the discussion before my presentation, and I think this will be very relevant to what you were all talking about. So as was mentioned, I do a lot of research on temperature and air pollution and health outcomes such as adverse birth outcomes. This is a study that I'm going to present a couple of slides on temperature and preterm delivery and was published in 2010. And here are the results that I have presented here by race ethnicity. It shows the percent change per 10°F increase in preterm delivery. You don't have to really get so stuck on the numbers. Really what I want to show here is that there's a disparity by race and ethnic group. You could see that the overall result at the top is about 8.6%. Every time there's higher heat exposure, ambient heat exposure, you see a higher risk of preterm delivery for all mothers, but there are some differences. So for these are as listed in the birth certificate data. The Black mothers had almost about a 15% increase compared to Hispanic mothers, which was about 8%. White mothers had about 6%, and Asian mothers, we were able to create this category in California, was about 10%. There are so many other risk factors that we looked at, but in the interest of time, I will just give you an overview here. There's from heat and preterm delivery specifically, as I showed you in the previous slide, it's Blacks, Asians, and Hispanics had the greatest risk. Also younger maternal age, that seemed to be a big factor. So below 20 or below 25 years of age. Having gestational or pre-existing hypertension or a diabetes for the mother conferred greater risk, as did alcohol use and smoking. So just recently, in the last couple of months, published a study that was a review of a bunch of different studies, including the one that I just told you about. This review had 68 studies and over 32 million births. It started in 2007 and included all the studies that through April of 2019, and really covered air pollutants like fine particulate matter, ozone, and then heat, and outcomes like preterm delivery, low birth weight, and also stillbirth. And it really showed the consistency between all of these studies and how important it is to really not only look at the relationships between these exposures and outcomes that I mentioned, but also to look at reasons for disparities. So I'm going to start with just some mechanisms that I think are important. Not all of the mechanisms are known, but I will share with you what we do know. Really, the main thing is that the symptoms start with dehydration. A lot of times, dehydration is not connected to ambient heat. So even though you might see, pregnant women who has headache or nausea, vomiting, rapid heartbeat, dry skin, excessive thirst, rapid breathing, dry mouth, even giddiness, those symptoms are often not really connected to heat exposure. And I can tell you from my 2 pregnancies that you really cannot thermoregulate or control your body temperature very well when you're pregnant, even in air conditioned environments. So it's important to look for those symptoms. From this dehydration, what happens is there's oxidative stress and inflammation. It's called systemic inflammation. So it really throughout your whole body. And then that releases oxytocin, which is a signal to induce labor. But before that, it decreases uterine blood flow. And so the fetus is not getting enough of the nutrients that it needs. And then that results in decreased fetal growth and can induce labor. So this is to answer your question, some of the reasons for the disparities. And if I had one take-home message slide, this would be it. The other ones were just more background information. First thing I want to mention is that we've seen greater exposures in itself. So without heat or air pollution, we already know that maternal health is worse for women of color, but we also have to look at the exposures itself, such as heat or air pollution. This is what we call environmental racism or environmental justice. So we know that there are some communities who live closer to power plants. Fossil fuel combustion is nearby, as are freeways or traffic. And also something known as the urban heat island effect, meaning that in urban areas, there are more blacktops, less green space. So there's more absorption of the heat exposure itself. There's some issues with lower socioeconomic status. And so that because of that, there's less ability to mitigate exposures. There's a high cost of using air conditioning. And if there's a wildfire, for example, or high levels of pollution or even heat, relocation may not be feasible. But I want to share that with, even with air conditioning, research has shown that there's still health impacts, and you can't rely only on air conditioning because we know that there's power outages and blackouts during this these periods when you need the air conditioning the most. And this is the main point. I think that there's less access to healthcare, or there could be less access to healthcare, but even with the same access to healthcare, there is evidence for differential treatment. And that's the main point that I want to bring. I think that there's not enough women of color who are healthcare practitioners or other, providing care or helping with care and advocating for equal care. And that's really important. I've heard so many stories of women telling me that there was nobody who looked like them, or they would tell their stories, nobody would listen. And then going back to the community level, there's not enough community involvement, but I know that's rapidly changing. And I think that is it for me. I look forward to the discussion. Thank you so much.
Great, thank you, Dr. Basu. Ms. Albert, do you also have some slides that you'd like to share with us before we get started with the question portion?
I don't have any slides, but I did want to give some information just to ground the conversation. So just in case folks don't know. So within the United States, Black mothers and pregnant people are 3 to 4 times more likely to die of childbirth-related complication or to suffer a near miss. If within New York City alone, Black women and pregnant people are 12 times more likely to die of childbirth-related complications or suffer a near miss. And a lot of that stems from the causes of institutional and interpersonal racism that individuals face when going to seek out healthcare within, hospital-based institutions. The other aspect of it is insurance segregation. So understanding how insurance segregation, those who are on Medicaid, as opposed to those who are on private insurance, face greater risk of not having access to home birth midwives, not being able to get adequate care. Doula services in and of themselves are not covered by Medicaid and or insurance. And so if you are a New Yorker and trying to access doula services, the average doula in New York costs about roughly between $1,500 to $3,000 to obtain services. And so you find yourself in a situation where individuals who may be at the greatest risk. And so looking at the social determinants of health, and so housing, transportation, food apartheid, these various different things, as well as environmental injustices, right? And so you start to live in an urban environment where one is in close proximity to another person, we're on top of one another, right? As as Dr. Rupa has said, living in congested areas, more pollution that arises, we start to see in the work that we do an increase of asthma in young children, an increase of eczema and skin rashes in young babies, different bronchial effects, as well as the impacts of low birth weight babies, compounded with oftentimes, you can have stillbirth and or miscarriage, right? And so when we start to look at the intersections of care and how these things play out, you start to see how it's not just about someone in their socioeconomic status. It's not about their educational level. It's not about, these various different things. What it boils down to it is people having equitable access to healthcare, but also addressing the various different climate issues that we have within our nation, right? That oftentimes go ignored. And we'll find that where we see the greatest disparities is within low income Black and Brown and Indigenous peoples who are experiencing climate change the hardest, right? And so when we start to look at access to clean water and we look at Flint and the ways in which, the water crisis happened there in Newark, New Jersey, there was also lead found in pipes here where people could not drink the water for a period of time, and they had to work to distribute water to residents, especially birthing people. And so doula organizations came together on a community-based level to be able to provide those resources. On a legislative piece, acts like the Momnibus Act, which has been put forward by Representative Lauren Underwood, is a great example of 9 bills that have come together to really address some of the intersectional things that come up when someone becomes pregnant, right? Because we don't become pregnant in a vacuum. It's not like you're just pregnant and those, now your main concentration is just on your pregnancy. That's a big part of your concentration. But a lot of it is, contingent upon, do I have the resources necessary to raise a child in a healthy environment? And as we, get into rural areas as well as urban environments, low income Black, Brown, and Indigenous people are the greatest risk for the effects of environmental injustices, as well as experiencing these low birth weight babies. So I just wanted to ground the conversation in, talking about the ways in which they do that. And as doulas and running a doula organization, we provide non-judgmental support to individuals, but we also are actively working to, on a community-based level, address these things by providing the resources that they need, right? So providing them with education around what does it mean to, talk to your landlord about, having air filtration in your apartment building? What does it mean to have conversations around having access to healthy food? So we give out grocery boxes. Actually, today we're giving out grocery boxes to community members. To give out diapers and the resources that folks need. But a lot of it is surrounded around the education prior to. What does it mean to if you have a smoker in the house, to tell them to wear 2 layers of clothes when they go out and smoke, so you can take those layers off when you come back in the home, because that too can cause, extra environmental issues. What does it mean for you to bike instead of, taking maybe public transportation that may be causing, more pollutants, or driving a car and putting more cars on the road, so things of that nature, trying to really work with people where they are, not where we expect them to be, and address it in an equitable way.
Great. Thank you both for sharing those facts. They're very helpful. So I guess moving forward, Ms. Albert, I am a little familiar with doulas, and I think for the most part, a lot of people don't have a wide experience or knowledge of the service, and you did a pretty good job of describing what the benefits are. as you said, as you mentioned, they're not really covered by most healthcare services. So do you think that as someone who, I don't know, may or may not have access to additional money to pay for doula services, what would be, I guess, your best advice on how to access those services?
Yeah, so there are doula organizations who provide free or low cost doula care. So like for instance, Ancient Song, which, you know, I run and have founded. We're located in Brooklyn, New York, and we serve all of the boroughs. We provide free and low cost doula services. You know, it's based on income. If it's sliding scale, so folks are able to access in a way that, again, meeting people where they are. We also do barter, which is something that people forget about as another form of currency. But I feel like, you know, if people have certain skills, like I honor that. And so like, say someone's a graphic designer and they're able to like, you know, create web design or logos or whatever we may need, you know, taking those things into consideration, because that's something that we would have paid for anyway, right? So what does it mean for us to trade a service for a service in order for your needs to be met? There's organizations like BX Rebirth, which is located in the Bronx, and they specifically focus on providing services to Bronx residents, understanding how the Bronx is oftentimes overlooked on many occasions and in many different ways. And so they provide low cost, free services to individuals in New York City. Unfortunately, we are not covered by insurance. We're not allowed to take insurance. There is a doula Medicaid pilot program that was put out by New York State, but it's currently inequitable for the consumer as well as for the provider, not paying the provider at a reasonable rate. And it also doesn't take into consideration the ways in which someone accesses care and how they too may not be reimbursed for the services that they're provided. So yeah, unfortunately, you know, I wouldn't say unfortunately, I mean, I would say, you know, for Ancient Song, we started in my house, and it started with feeding folks and listening to people's stories and really getting to know the community and what the community needed and wanted. And it's continued to grow, you know, into that where we're still doing those same things. We're meeting people where they are, you know, getting to hear their voices and find ways in which to be able to shift that. I think another thing is the New York Health Act is a great way to have universal health care for all in New York City that would cover doula services and find a way for the services that we provide to, you know, so it doesn't have to come out of our pocket. So far, we've been able to sustain ourselves through community support as well as, you know, grant funding, but, you know, taking the burden off of the consumer is what's most important.
Great, thank you for that. Dr. Basu, you also mentioned that the environments that we live in play a big factor in the outcomes of birth, as far as stillbirth and low weight and preterm birth. Do you have any, based on your research, do you have any kind of advice or suggestions on what expectant mothers can do to kind of prepare their space for themselves and their children?
Yeah, I think the main thing is to really have the information. So when I mentioned the mechanism and how things often start with dehydration, which is completely treatable if you can look at those, you know, if you know the symptoms, you know, that kind of thing. Also, if you could, you know, when you're not able to cool down, even if it's not even that hot outside, there's evidence to show that it's really your core body temperature. So, you know, to go and it might sound so simple, but, you know, at the time might not occur to women to just try to cool down in air-conditioned environments or fans, or even, you know, take more cold showers. It seems like, you know, a very simple thing, but I think it just doesn't happen. And a lot of these birth outcomes are really preventable. So that's a you know, a really important thing to remember. Of course, there's so many other issues that could be happening, but these issues are really exacerbated by the heat or the air pollution. So also residential areas that have more heat absorption. We know that there's urban areas that have maybe less green space. So if you go into areas that have more, that could help prevent the actual heat exposure itself. Same thing with air pollution. If you're in a very polluted environment, typically in urban areas, then to also move or at least be in areas, even if it's temporary, that have less air pollution exposure. There's also filtration systems, as somebody mentioned in the chat, and those do help, especially reduce particulate matter, which is one of the main risk factors for these adverse birth outcomes when it comes to air pollution.
Great, thank you. So I think that based on that.
There's some wonderful questions in the chat room. I would love to answer if it's possible, if there's time.
Absolutely, yeah, I was just about to segue to that. So go ahead and did you have one in mind already, or?
I know someone asked a question in regards to COVID and the research on COVID and the, what is happening with is there evidence of greater mortality to mothers? As of right now, the information is being tracked and there's no actual, studies that have been published as of yet, because it's too early to tell. I will say that COVID-19 has exacerbated the ways in which Black, Brown, and Indigenous women and pregnant people are able to access healthcare services. So we're already where you were facing a lack of access to services, it has become greater. There have been recent stories that have come out early, I would say April, May, in regards to COVID deaths. And so one mom in particular, Amber Rose Isaac, gave birth earlier during the beginning of the pandemic. And, because of the pandemic, wasn't able to get appropriate healthcare 2 days prior to her passing. She had tweeted about her healthcare at the healthcare institution, saying that it was inappropriate, that they were doing a poor job. And then she died of childbirth-related complications. There was also Shaija Washington, who passed at Woodhull Hospital, who was affected by medical racism during her birthing experience. There was a mom, her name slips my mind, but it was a mom who was pregnant with twins who lost one of the twins during COVID. And a lot of it, is suspected to be due to the fact of the ways in which she was treated during the pandemic. And so while there's no necessarily a lot of evidence right now to show what is happening, because again, it's something new and they're still studying it, there are stories and narratives that have someone else asked a question. There was another question I saw that was really great. Oh, how can we increase distribution of air treatment systems in affected communities? I think that would be like a super amazing initiative. I think it would take us to get the funding to be able to do so, because we work with a lot of low-income individuals who live in, various different low-income housing. And so being able to provide that to them and to their families would be extraordinary, especially if it would help to reduce some of the ways in which they, clear air.
I think you froze on us. Okay, get back. We're getting a little static lag on your mic.
Yeah.
Dr.
So
yeah.
Can I also add to the, I think those are excellent points. And one more thing I wanted to add to the COVID question is that there's actually also evidence for comorbidities, or what we call, like, if there's a population already at higher risk for asthma, for example, and then that weakens respiratory system, the lungs. And then what happens is with COVID, that just makes things so much worse. And we know that that's already disproportionately more frequent in areas that are primarily Black or Brown communities. So that's why we have not only the birth outcomes we talked about, but also, asthma, lung diseases, some, heart attacks and diabetes, so many other health outcomes. And then to bring COVID into the mix, it's just another big issue that is really impacting the same population again.
Great, thank you both. I believe we are at the end of our time, but I don't know, Marquise, do we have additional time, or should we keep moving?
Sure, I think we have time for maybe one or two at the most to ask their question directly. Come off mute.
There's a lot of questions in the chat. Maybe we could choose a few.
Yeah, I see that there are some. Let me see if I can find the one I was just looking at.
While they look up the chat, is there anyone who asked a question in the chat that want to ask directly and come off mute? I see.
Actually,
Go ahead.
Is anyone raising their hand?
I'm gonna bring up Gwendolyn Black's question. If there's any info on how the environment is causing an increase in autism.
There are studies to look specifically at that. That's not something that my group does, but there has been some studies, I want to say out of UC Davis and other places, to look specifically at environment and autism. They have the Mind Institute and studies that have come out of that to show some association between air pollution specifically and autism risk.
Thank you.
I also see, sorry, Emily.
I was just saying,
I also see a question from Nia Savant for Dr. Basu that says, does the research on preterm births currently consider or incorporate intergenerational effects such as grandmother's health or exposure?
Yeah, that's a really good question. And I wish we could look at that, but with the birth certificate data, we can't identify the moms or the infants, or even if it's a mom who's had multiple infants, we can't even look at that. So we can't look between generations, but I think that would be a really interesting question to answer.
And I also have one more question coming from the chat. Maybe if you both would be interested in chiming in. They said, has there been an increase in governmental support for these efforts that you're working on or studying?
Okay, so I can start. I don't know how to answer that question specifically, at least for the federal level. I know in state, we're trying to increase the support. I mean, just being able to show or have data to support what we kind of already knew about this, environmental justice issues is really bringing this this issue to light. And I think that's helping with some support. Do we have enough support? I don't think so. I think we need more, way more support. But we're trying to, with this research and, even some clinical practice for others, trying to really make that more of an issue, make healthcare more accessible.
Great. And I guess I'll end with you, Ms. Albert. Have you seen an increase in governmental support for doula services or anything coming down the pipeline maybe?
Oh, I think Chanel's having internet issues.
Yeah,
Okay.
She said, can you repeat the question, she said?
The question was, there was a question from the chat where someone was asking if she was aware of any governmental support that was possibly going to be provided for dual services in the future.
Okay, so hopefully my internet won't cut out again. So there are, again, there's the Mommies Act, there's the Mamas Act by Senator Booker. There's also the Momnibus, which includes doula services as well as perinatal community support workers.
Wait, it's cutting out a little. Sorry, Chanel.
Yeah, I think she is.
Maybe she could place in the chat too.
Yeah, maybe turning off your camera will boost up your strength.
Mhm.
Okay. Want to try now? No? I should. All right, maybe we can come back to you, Chanel, to answer this question before we leave. How does that sound?
Yeah,
So,
she also placed it in the chat. She put Mama's Act, Mommy's Act, and Momnibus Act. That's at the government level, what's been being done. I'm not sure if that's like state or local, actually. Chanel, maybe you could.
I think one of them she said was by Senator Booker, so that would probably be federal level.
Great.
Thank you both, Dr. Basu and Ms. Albert, for joining us for our panel. You gave us some really good points to think about and information that we can definitely use to move forward in our work. So I'll give it back to you, Emily.
Sorry, I'm on mute. So thank you so much. That was a wonderful panel, and I'm sure that people still have a million questions, as I do, about maternal mortality or just in general about women's health. So moving on with the program, unfortunately, we do have just a little bit of time left. We're going to go now into the part of our meeting that's call to action. And I believe it's led by someone in our staff, Marquise or Sono.
yes, Sono will be leading us through this next section.
Hi, everyone. Thanks for being here. I hope you learned a lot. I definitely did. So I just want to kind of go over a couple action items when it comes to, there's a big issue of Black maternal health, Black maternal mortality, preterm birth, all of these different kind of environmental racist policies and programs that make it more difficult to have healthy processes. We talked about access to healthcare for Black people, Black women that are giving birth, and all of these things are all kind of wrapped up in a lot of different issues around institutional and systematic racism, like our speakers mentioned. So I'm just going over a couple action items. One is that was mentioned a few times in our discussion is the Momnibus Act. It's a really exciting act. It was brought by Congressman Lauren Underwood. I believe she's in Illinois. And this is a federal bill, so it's across the whole United States. And you can go to the next slide, Marquise, thanks. So this Momnibus is basically, the term Momnibus is kind of like a pun from the word omnibus, which is a way that people talk about if they take a bunch of different bills, a bunch of different kind of like laws they want to pass and put it into kind of one bundle. That's what an omnibus is. And so they're calling it Momnibus because it's about birth and pregnancy and maternal health. So just in general, this act is a bundle of 9 pieces of legislation, 9 bills that address kind of like the whole sphere of issues that are specifically that are seen for Black maternal health issues. So the overarching goals is to fill gaps in existing legislation to comprehensively address every problem of the Black maternal health crisis in the United States. So when we're, oh, you can keep back. So when we're talking about that, that's includes environmental racism, environmental justice issues like we were talking about today. It also includes other issues that affect people of color all the time, like healthcare access, unemployment, job issues, like there's bills around people that work in the military, for example, and how that might affect your maternal health. There's kind of, it's a full range of issues. So it's not even just environmental, it's even much bigger than that, which is really exciting. So now, Marquise, you can go to the next slide. Thank you. So this is just this is all the name of the 9 bills. I didn't write them all out because it would just be a lot on a slide, but here I'm posting a link. You can click on this link and you can find it really easily by just searching like Momnibus USA or something like that. It'll come up pretty easily on Google, and you can read the summaries of each of these different acts, but they all together are really hopefully going to make a big difference in addressing Black maternal health disparities that we see in the United States. And so an action item that you can do is to encourage your federal representatives. So for most of us here, that's Senator Gillibrand, Senator Schumer. We also have people in Congress. That might be Adriano Espaillat for a lot of us here. Encouraging them to support these bills, to support this Momnibus Act, and to try to push that forward. We potentially have some opportunity in the new administration. We'll see how that goes. But this is a really exciting piece of policy. So the one that really addresses the environmental aspects is also the first one, the social determinants for moms. Social determinants, as a lot of you know, are kind of like all the things in your world that kind of affect your health. So environment is part of that. It's kind of like where you live, work, play, pray, learn, and how that might affect your health. So we can go to the next one. Next slide. Oh, thank you. And then, so now there's a couple things that you can specifically get involved in with WE Act to work on these issues. And we're working, of course, on the environmental side. So we're kind of trying to impact the causes, the drivers of a lot of the Black maternal health disparities. So like Dr. Basu and Chanel mentioned, heat is a major driver of that. So we know that, like Dr. Basu explained, dehydration, overheating can impact the health of your birth and yourself when you're pregnant. So it's really important that as heat is getting worse in New York City, as it's rising, it's becoming more frequent, we need to try to combat that. And then the second is childhood lead poisoning. We thought it would be important to bring that up now. That is really important, not only for a birthed child, a baby, but it is, and an infant and through the development, but it's also important for pregnant people to also make sure they have low lead levels, because we don't want to transfer that onto the child. So you can go to the next slide. So extreme heat, just quickly, we know that it's getting hotter for longer in New York City. So something that WE Act is really working on is trying to get sustainable cooling. So like Dr. Basu said, going into air conditioning spaces is a really important thing that pregnant people can do to protect themselves and protect their child from adverse health outcomes. So something that we actually advocating for is sustainable cooling. Maybe our cooling comes from renewable energy, that there's cooling in your home, but there's also access to cooling, free cooling outside of your home. If utility bills are really high, or cooling systems aren't working, or you're out and you need to cool down somewhere else, there should just always be good access to that. So that's something that WE Act is fighting for in our Heat, Health, and Equity initiative. So that's one way you can get involved, is get involved in that side of the work with us. Next slide. And then the next one is childhood lead poisoning. So right now, New York State has, last year, New York State passed a really great ruling that is lowering the elevated blood lead level for children that's allowed for children. So really, I'll say a lot of the research has found that no amount of lead exposure for children is good or is okay. There is no threshold where you don't see an impact. So basically, we need children to be exposed to 0 lead. And then, as we all know, because we talk about lead a lot, it exposes children to developmental delays, neurological issues. It can lead to behavioral issues later. It can lead to trouble kind of with your general brain development. So it's really important, especially under 6 years of age, to not be exposed to lead. And that's something that we see communities of color, low income communities in New York City are exposed to much more than other places, than other neighborhoods, because buildings might be still covered, painted with lead paint. So we always need to make sure that when you are expecting a child, if you have a child, or even just adults also should not be exposed to lead. So you want to make sure that your house is lead free. There's laws in New York City that make it so you do not have to live in a home with lead. There are laws that that is not okay. Your landlord has to abate your lead. The next piece is Introduction 864 and 874A. Those are things that we is actively working on also. There's 2 bills in City Council. This would be a big, these bills would be a big deal. If they pass, one helps us kind of reduce our inhalation of lead dust from construction, which is kind of can happen a lot in New York City because buildings are really old and still have lead paint in them. And then the other one is that it's expanding if a child is found to have an elevated blood lead level. So every child in New York City and New York must get tested for that when they're very young. If they have elevated levels, now we're saying the government has to go test your home, any place where their child spends a lot of time, and the whole building where that child lives in must then be inspected, which is new. That's not something that New York is doing yet. So it's a way to cover more people and make sure that kids aren't being exposed to lead. So an action that you can do is tell Speaker Johnson, our leader of the City Council, to move those bills forward and vote on them. He has not been doing that, and we're trying really hard to get him to pay attention to lead as an issue. Coronavirus has kind of become the main thing people are thinking about. Obviously, we understand that, but there's all these other urgent matters that still need to be addressed. We don't want our children continually exposed to lead, even though there's a pandemic, right? We should be addressing all of these things. So that's something else that you can get involved with. And then next slide. So this is the last slide, but if you want to be involved in the lead work or the extreme heat work, both of things are very important for protecting our child health, our maternal health, health of a pregnancy. This is, something you can be involved in with us. So if you want to tell me you want to be involved now, we can add you to our list. You can just type in lead or heat in the chat, or you can always email me and let me know that you're interested in being involved. So that might be testifying at hearings, going to kind of like right now, virtual press conferences and rallies and things like that, writing to your representatives, bringing in more people, increasing awareness of these issues. So please join us, and thank you.
Great, thank you so much, Sonal. So that was our call to action. Definitely everyone, please get involved with local government. This year was exemplary of the importance of the individual's voice, especially in issues that impact us, even with the simple act of voting, okay? Everything that we do at the individual level is extremely important. And like I said, this year, exemplary. So it's great that you are all here to acknowledge and to have this conversation with us about this particular issue, maternal mortality, but it's also part of the bigger umbrella issue of environmental justice. So let's use our power of voice through calling, as Sonal just mentioned, using our social media platforms, emails, everything that we could possibly do just so that we could demand for what we need just to get our good health. It shouldn't be a privilege. It's just like, it's a human right, So getting our good health and to get environmental justice. So thank you so much, Sonal. Everyone, please look through, we're probably gonna send all these things through email, right? I'm not sure So yeah, so she's nodding. So through email, we're going to send all these action items just so that you could, you know, like know where to call, who to address for these issues. And also thank you for being here to talk about women's health. It's extremely important. I know that I read a lot of spiritual books and things of that nature, but I know that a women's state of health represents the state of the family's health, the state of the community's health, the state of that region's health, the state of the world. So for me, it's like womb health and all of that. Like it's definitely representative of our communities. Like it's always a bigger picture. It puts the family together. So something really important to talk about today's topic, okay? So now I will lead us off to the closing with Marquise.
Thank you all so much for joining us today. Special shouts and thank you to our guest speakers, Dr. Busa and Chanel, for joining us and providing such valuable information. I want to thank the Membership Planning Committee for coming together again every single Friday to put together a program for you all to educate you and motivate you to get involved with our campaigns. Just as Emily described, we are talking about the globe to the womb. Everything that happens in this planet impacts the way we live, the way we operate, and it impacts the new generation that is coming in. And so all the work, climate justice, healthy homes, all of this work is all leading to making sure that we have healthier communities. And we could not do this work without you all. It is a Saturday, it is after 10 o'clock, and you guys decide to make this a priority to join us today and be here with us to learn and take action on this very important issue. As we mentioned earlier, we are sad, we are at a loss, and we have a huge gap that we are trying to fill. And having you guys be a part of this, we need you now more than ever. And we lost our Deputy Director, Cecil Mark Corbin, Cecil Corbin Mark, who was just a giant in the environmental justice world. He dedicated his entire life to making sure that he can improve this planet for all the moms, for all the dads, for the sons, nephews, godparents, everyone in the entire village. And so while he is gone, he has left his legacy with us to continue to carry on. And I am honored to be entrusted with such passion, gift, and dedication. There will be a memorial service that will be held that We Act is holding for Cecil. I'm pulling up the information now for you all to see. This memorial service will be held via Zoom. And so I'm going to ask one of my coworkers to place the link into the chat box for you all. I hope that you all will take the time to join us on Thursday, November 19th at 6 p.m. to come and share all of these amazing and inspiring stories and your experience with Cecil. I want to thank everyone who stepped out of their shell and made themselves vulnerable today to say a few words. Cecil, member D, longtime We Act member D, and for sharing stories about welcoming a newborn into your family. Next month, December 12th, will be our annual membership meeting. During that meeting, we will take a look back at all of the things that we have been able to accomplish. It has been no easy year in navigating this pandemic, but nonetheless, you are fierce fighters and have continued to fight despite all odds. And so it'd be exciting to see all that you all have achieved this year. And then we're also going to take a look forward. what it is we have planned for 2021, building off of all the accomplishments that we have made this year. So I hope that you will join us at Cecil's Memorial. I hope that you will join us in December for our annual meeting. And I thank you all for joining us tonight. I mean, this afternoon, excuse me, it's already night. What am I talking about? This afternoon for this membership meeting. Be well and enjoy the rest of your day.
Great meeting as always. Thank you, WEAC. Thanks,
Yep,
presenters.
you guys have a great
organizers.
day. See you on the 19th.
Thank you.
Great seeing you, Emily.
Thank you
Flora,
all
great
for
seeing you.
joining. Nice seeing you
Sarah
too,
Fisher.
Bigly.
Hi, Sana.
We missed you.
Buddy. Miss you, Lewis.
Jose,
Washington and Lana.
Harry Sheffield, love you. Take care.
Bailey.
Yes, yes.
Love you, WEAC.
Yes.
Thanks for making my
Juan Gores, East Harlem in the house.
Hey, Louis.
Yes.
Juan.
And if you're not a member, remember to pay your dues.
Oh, absolutely.
Gotta pay our dues, y'all.
That's right. I'll send my check in. I'll definitely do that.
And everybody, please be sure to check out the exhibition at the Dykeman Farmhouse. And as we're talking about healthy eating, it was enslaved and freed Blacks who cultivated that farm. It's called Unspoken Voices, honoring the legacy of Black America. And you can see it on New York One and a lot of media. It's a great exhibition. I'm a part of it with 2 other artists. Please go to dykemanfarmhouse.org. Look at it. It's filled up, I think, through December. The exhibit will be up until next year, but do go and see it. But check it out.